Hi everyone, I am Ashwit of grade 10 from Lux International School. Today we are going on a physical science field trip under the lesson Acids, Bases and Salts. In this lesson we have learnt about plaster of Paris, which is used for setting of fractured bones. To learn about this, we are going to visit Renee Hospital. Let's go.
Good afternoon everyone. So I welcome the Lakshya School 10th class students or 9th? 10th. I welcome all 10th class students of Lakshya School to the Renee Super Specialty Hospital to have an interaction regarding orthopedics. That's all you want to know? Anything else? क्योंकि मुझे अरबी या उर्दू हिंदी अच्छी नहीं आता. Okay, we can communicate in English. Today's official language for us is English. So why do you need to know about orthopedics? Is it your syllabus or you are out of interest you have come here? In the past, orthopedics means when people used to do this conservative. Conservative means management of fractures without surgical intervention. That's called as conservative. Two types of management: conservative, medical or operative. So conservative means without any surgery, by using medications and available splints. That is called a conservative way of management. Means joints. PDs means in old age people used to born with deformities like this, right? In ancient days, so they used to correct these deformities by tying the deformed part to a straight stick or a rod or a splint. We call it as a splint. When a small plant, when you plant it, it may grow in a different direction depending upon the environmental factors and the genetical factors of the plant. Suppose it is going in a wrong direction, you just give a stick, tie it to that straight one and leave it, it will start growing in a straight direction. That is the reason in this orthopedics first started in children's, correcting the deformities, right? That is a PDs means the science dealing with the childhood up to 12 years of age. So orthopedics by means, the name implies is correction of deformities in children. So this word is continuing and now it is misnomer, because orthopedics now is evolved along with how the science is evolving since last 100 to 150 years, right? So now the orthopedics is a different entity, entirely different entity, and this word now is misnomer. What do you mean by misnomer? It doesn't apt to the kind of procedures we are doing now, but this is intelligent student. Any one of you? It is the orthopedics started by correcting the deformities in children. It is not started by treating the fracture patient. It is not started by replacing your joint. It is not started by operating on your back. Ancient days it started by correcting the deformities in children. Children used to have scurvy, vitamin D3 deficiency, poliomyelitis, cerebral palsy. These kinds of diseases are rampant in the past. That is the reason they have given this word, correction of deformities in children. Orthos means joint. PDs means the science or medicine dealing with the treatment of children, pediatric age group. The medicine, pediatrics means Science of medicine dealing with the treatment of children. That's why we call it as pediatrics. So orthopedics movement happening. So who makes the movement around the shoulder joint? The muscles around the shoulder joint. The muscles makes the movement, right? How does the muscle make the movement? Muscle has got two ends. One is origin, other one is insertion. The muscle which crosses this shoulder joint, it starts acting from here and ends here, right? When it starts acting, it is an elastic fiber like a rubber band. When it acts, it shortens its length, right? When it shortens its length, automatically from origin to insertion, it will get lifted. This is called as abduction. This movements. So muscles makes the movement with the help of tendons which attaches to the bones. Who tells the muscle to do that movement? Brain, right? Lift your shoulder. The same reflex. When I speak, it goes to your ear, to the part of the brain, recipient brain, and the motor part that activates. And he is intelligent. His reflex arc is normal. That's the reason he is lifting it. So the brain tells the all parts of the body to certain voluntary functions. I'll tell you later what is voluntary, what is involuntary. Voluntary function, right? Voluntary function means if I ask him to do, he is doing. Involuntary means there are certain reactions in the body, functions in the body goes without any knowledge of ourself or yourself. You cannot, certain functions are happening. So the musculoskeletal system contains the bones, the joints, the muscles, the tendons and ligaments. So next slide. So I told you muscles can be voluntary muscles, we call it as skeletal muscles, and involuntary muscles. The function without our notice, like gastrointestinal. When you take food, today you take food, you have to, that food has to exit in a different form tomorrow without our notice, right? So inside there are involuntary muscles which cause contraction and propel the food through different parts of the gastrointestinal system, and next day morning it starts at the exit door. It gives a signal. That is the movement happening without our notice. That is involuntary. What is called as? What is voluntary muscles in the body? Skeletal muscles. All skeletal muscles. Skeletal means, skeleton means the structure of the body which is made up of bones. So all the muscles which gets attached to the muscles are mean to function whenever required are signaled by the body or by external stimulus, right? Okay. So your shoulder. Take out this. Today you will see your six pack. Nikalo, I'll just show you. Nothing. You are the best person. Hey, only this thing. There is a bone, right? There is a bone. This bone has articulating with proximally. This bone is called as humerus. Okay. It articulates with the one joint above, that is shoulder joint. One joint below, that is elbow joint. Right? And to move this joint inside, to move one joint inside, you need a muscle which should be start from here and it should cross the joint. Otherwise, if it don't cross, it won't move the joint. The muscles which originates and ends within the bone, proximal to distal, they don't move the joint. You got my point?